Welcome, 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 welcome. Today's lesson, we're going to be talking about how our modern day diseases stem from what I call metabolic dysfunction and energy shortage from insulin resistance and dysbiosis, and how that results in all the chronic diseases that we face in modern day society. Welcome, Yakita. Welcome, Enfala. Welcome, invite guests. Welcome, Beatrice. Welcome, Insurance Messi. Welcome, welcome, welcome. I'm glad to have you guys today on our show today. Today's topic we're going to be talking about, today's lesson is how many of the modern day diseases that we have stem from something we call metabolic dysfunction, an energy shortage, and how that energy shortage is driven by two things: insulin resistance and gut dysbiosis. And I'm going to be teaching how a targeted nutraceutical helps to be able to reverse that metabolic dysfunction or the energy shortage. So welcome, welcome, welcome. Dings, welcome. Remeric, welcome. Jeannie, welcome. Oshi, welcome. Blaze, welcome, welcome, welcome. My name is Dr. Dieter, and today we're going to be talking about chronic medical conditions and how chronic medical conditions stem from two things: metabolic dysfunction, which is an energy shortage. So I want to welcome you, welcome you, welcome you. There is now convincing scientific evidence out there that shows that most of the chronic medical conditions that we face today in modern society, come from energy shortages, an energy shortage in the body. And that energy shortage in the body results in all the diseases that we face today. I'm going to teach about how that comes about. And then after teaching about that, I'm going to talk to you guys, teach about two targeted nutraceutical products that can be used to reverse those energy dysfunctions to cause you to be well again. So welcome, welcome, welcome. My name is Dr. Dieter. I hold board certifications in two fields. I hold board certifications in two fields. I'm a board certified pediatrician. I'm a board certified internist. And today I'll be talking to you guys about how our chronic medical conditions come from reversible causes called metabolic dysfunction. So right there, those are my credentials. Board certified as an internal medicine physician, also board certified as a pediatrician. We're going to talk about how modern day diseases today come from reversible energy shortages in the body, and how those reversible energy shortages, can actually be treated, so that you do not have diseases. So welcome, 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 welcome again. And as usual, what I'm going to do is I'm going to flip over. I'm going to do this teaching where you're going to see me one-on-one. And then every now and then, every now and then what I will do is I will go to the board, so that you can see me. So right here. So every now and then I'm gonna flip and go to the board and do a lot of teaching and explaining on the board. So I will move from this view to the other view, back and forth, back and forth. So bear with me when I do that. That is to give you guys as much information as we can. So welcome. I want to welcome, if you're joining us from the Northeast today, maybe you're joining us from Connecticut, Maine, Massachusetts, Rhode Island, New York, Pennsylvania, Vermont, New Hampshire. Welcome, welcome. If you hear if you hear the name of your state, please shout out. Welcome. If you're joining us from the Midwest, maybe you're in Illinois, Indiana, Michigan, Ohio, Iowa, Wisconsin, Kansas, Minnesota, Missouri, Nebraska, the Dakotas, North Dakota, South Dakota. The other day I had somebody on on my live from North Dakota. So joining from any of the Dakotas, you are welcome. My name is Dr. Dieter, and today we're going to be talking about how, our chronic medical conditions today, are driven. We're going to be talking about how our chronic medical conditions today are driven by something we call metabolic dysfunction, and how that metabolic dysfunction is an energy shortage that results in all the chronic diseases that we face. And if you can reverse that energy shortage, you could reclaim your health again. And my mission is to help as many people to be able to reclaim their health. So to my people in the South, maybe you're joining me, you're in the South, maybe you're in Delaware, maybe you're in Alabama, Arkansas, Louisiana, Oklahoma, Texas, the Lone Star State where I am. Shout out Tennessee, Mississippi, Kentucky, West Virginia, maybe Delaware, Florida, Georgia, Maryland, the Carolinas, North Carolina, South Carolina. Welcome, welcome, welcome. I want to encourage you, to invite or share this live with other people, because today we're going to talk about how modern day diseases that we're facing today, the diabetes, the high blood pressure, the high cholesterol, the sleep apnea, the heart disease, the strokes. Those are diseases that our ancestors did not have 100 years ago. The obesity, the fatty liver, the cirrhosis. And today I'm going to teach us on how those diseases came to be and what you can do to reverse that disease. The depression, the anxiety, the irritable bowel syndrome, the Crohn's disease, the psoriasis, all those things, those modern day diseases, our ancestors 100 years ago did not have them. Gout, what have you? So if you know somebody suffering from a chronic medical condition, please invite them to join, because we're going to talk about how those diseases came to be, and then I'm going to teach on a targeted nutraceutical product. I'll just tease here. We'll talk about these two products at the end and how these two products can be used to reverse your energy deficiency. So if you're joining me, maybe you're joining me from the West Coast, California, Oregon, Washington State, Alaska, Wyoming, Utah, New Mexico, Nevada, Arizona, Colorado, Idaho. Welcome, 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 welcome. And I know that we have an international audience sometimes. So if you're joining from the Middle East, maybe Egypt, maybe Jordan, maybe Kuwait, maybe Morocco, Oman, Saudi Arabia, United Arab Emirates, South Africa, welcome. Sylvie Joy, Cameroon in the house. Welcome, Sylvie Joy. Sylvie, I'm from Cameroon too. So I'd like to know what part of Cameroon you are from, Sylvie Joy. And I would like to know where you're joining us from. I'm a native of Cameroon, based in Fort Worth, Texas. Sylvie Joy, if you don't mind telling me where you're joining from, if you're physically in Cameroon, or if you're somewhere else in the world and where that is. I'm glad to have you. Welcome, welcome, welcome. I'm just dishing out welcomes. Asia Pacific, if you're joining me from Hong Kong, Taiwan, Thailand, Australia, China, India, Japan, Malaysia, New Zealand, welcome to my show today. We're going to be talking about how our chronic medical conditions we face today in modern day society come from energy shortage called metabolic dysfunction that now fuels and causes all the diseases that we have. If you're joining from Europe, maybe you're in Slovakia, Slovenia, Spain, Sweden, Luxembourg, Latvia, Lithuania, Switzerland, Turkey, United Kingdom, Austria, Belgium, Bulgaria, Cyprus, Croatia, Denmark, Estonia, Germany, Greece, Hungary, Iceland, Italy, you are welcome to today's shows. These issues that we face today in modern day society are ubiquitous. They are all over the world. In modern day, the diseases that we have in the US continent, in the Asian continent, in the Middle East, in Europe, in Africa, all those diseases today as stemming from modern, those modern day diseases are stemming from the way we live our lives. And so Europe is not excluded. In the Americas, if you're joining me from Canada, from Colombia, from Dominica, Dominican Republic, from Puerto Rico, you are welcome. So I hope I have covered as many. To my international audience, I want to welcome you, and to my US audience, I want to welcome you. I'm going to reintroduce myself again. My name is Dr. Dieter, and I hold board certifications in 2 fields. I'm a board certified internist and a board certified pediatrician. Now, how did I get here? So 2 years ago, I listened to an interview from a renowned doctor, a functional medicine doctor, Dr. Casey Means. She was talking about the state of the healthcare system in the United States. And when I listened to that book, it gave me the inspired me to go. I listened to an interview she had given about the state of our healthcare system. Then it inspired me to go read her book. When I read her book, I gained a profound realization that most of the chronic medical conditions that we face today, the diabetes, the high blood pressure, the high cholesterol, the sleep apnea, the gout, all of those modern day diseases come as a result of lifestyle and food choices, and that in most cases, those diseases, could be improved. It could be improved and even reversed just by simple lifestyle choices. In her book, she explained how the current medical system often fails patients with chronic disease. Our medical system is fantastic for an acute illness. You have a broken hip, a medical system will patch your broken hip up. Your acute issues, you have a pneumonia, an infection, our medical system is great. The name of the book is Good Energy. Thank you for asking. Good Energy. I'm going to type that in here. Good Energy. That's the name of the book. Good Energy. Good Energy. It's a great read. Good Energy. That's the name of the book, Good Energy. So how our current medical system, it's great with acute conditions. You're having an acute heart attack, it will save your life. You're having a stroke, it will save your life. Acute issues. You have a broken leg, it will save you. But the chronic issues has failed a lot of us. How many of you guys have been chronically on medicines for more than 1 year? Maybe chronically on medicines for diabetes, maybe chronically on medicines for high blood pressure. Drop a comment in the chat, chronic. This is the point, that our current medical system in the US and for the most part, even in the world, fails patients dealing with chronic medical conditions. They give you pills for blood pressure. You're on blood pressure pills for the rest of your life, or pills for diabetes, or pills for gout, or what have you. And that when I read this book, understanding that most of these chronic medical conditions, are reversible. And I felt a bit cheated by the medical education that I had. Because when I went to medical school as a doctor, nobody ever taught me that, hey, Dr. Dieter, did you know that diabetes is 100% reversible? Did you know that high blood pressure is 100% reversible? I came out of medical school with $380K in debt in student loans, but I did not have the valuable information to touch and change my patients' lives. So when I read her book and learned about this information, I felt cheated. Wow. But at the same time, I had a conscience check. And that conscience check, I realized, I was like, I could no longer continue to practice medicine the same way. You see, in medical school, the way we were trained to be indoctrinated, to be narrow-minded, that when we see high blood pressure, we write a prescription for high blood pressure medicine. We see diabetes, we write a prescription. Hello, Noah. Thank you for joining. You see diabetes, you write a prescription for diabetes. You see high cholesterol, you write a prescription for high cholesterol. We were never taught to ask ourselves, okay, why does this patient have high blood pressure? What is the cause of the high blood pressure? Can we reverse? Lawanda, welcome. Thank you for joining. Can we reverse the cause of the high blood pressure so that this patient is not on medicines for the rest of their life? We were not trained like that. And so when I learned that these diseases are reversible, I had a conscience check. I could no longer continue to practice medicine the same way. So I made it my mission that I'm going to inform as many people as possible, to help as many people as possible to be able to reclaim their health. And that conviction drove me to, to where I am today, talking about these health issues publicly, online, everywhere I can, having a loud microphone to tell people you can reclaim your health. So that's the news that I want to give us today, and we're going to get on with the show. I'm going to start by, I'm going to share that. So if you're just joining us, a lot of you joined us in the last 5-10 minutes. If you're joining us today, the topic of our lesson today is going to be how most of the modern day diseases that we face come from an energy shortage called metabolic dysfunction. And that energy shortage from metabolic dysfunction is driven by two things: insulin resistance and abnormal gut, and how all those things drive all the diseases we face. But there is good news. This could all be reversed, and I'm going to teach you how this comes about and how to reverse it so that you can reclaim your health. Now let's do. I'll start by putting up the first. Okay. Okay. Can you guys see that slide just fine without any obstruction? If you could see the slide that I just put up there without any obstruction, please give me a thumbs up. I want to know that you're able to see the information without anything blocking your screen. If you could see it, please give me a yes. Okay, with no obstruction, wonderful, wonderful, wonderful. All right, I'm going to flip over and we are going to head to the screen. Thank you, Lizzie. Thank you, thank you, Noah. We'll get to it. We'll get to it. All right, I'm going to start with this slide. This slide that I have put up, that slide shows that most of the chronic medical conditions that we're facing today are coming from two things: insulin resistance and gut dysbiosis. So there is now, insulin resistance, and I'll explain this. Insulin resistance and dysbiosis result in something we call metabolic dysfunction. Metabolic dysfunction, guys, is just simply a fancy medical term to say energy shortage, okay? Sure, so it's just an energy shortage. And that energy shortage then drives all the chronic diseases that we face today. So all our chronic diseases that we have, you have diabetes, obesity, high blood pressure, high cholesterol. All these diseases is chronic diseases as a result of energy shortage in the body. And you see, every cell in the body requires energy to function. The simple definition of a disease is a cell that has malfunction. You see, cells make up tissues, tissues make up organs, organs make up systems, systems make up the body. So the smallest entity of the body is the cell. So a cell, when a cell malfunctions, we say that the cell is diseased. A malfunction cell results into a malfunction tissue, a malfunction organ, a malfunction system. And the number one reason why a cell malfunctions is the lack of energy. So all these chronic diseases that we face today are coming from this energy shortage. And this energy shortage, in fancy medical term, is called metabolic dysfunction. And that is coming from two sources. It's coming from insulin resistance and dysbiosis. Dysbiosis, what we say, gut dysbiosis. I'm going to explain to you what dysbiosis is, or the microbiome. So what happens is that these two, insulin resistance, comes and contributes to energy shortage, and dysbiosis, which I'll explain to you what it means, contributes to energy shortage, and that energy shortage now contributes to all the diseases that we have. To all the diseases that we have. Now, I want to take, so that's that. That's the basis of this talk, that all the chronic medical conditions that we face today are driven by energy shortages. So, if I'm going to let's take this off. If you have high blood pressure, if you have high cholesterol, if you have sleep apnea, if you have PCOS, you keep talking and talking. If you have any of those, all of those are driven by energy shortages. Now, let's take each of them together and talk about them. Let's start with talking about insulin resistance. I've mentioned that the energy shortage comes from two things: insulin resistance and gut dysbiosis. What is insulin resistance? Let's talk about insulin resistance. What exactly is insulin resistance? Now, I'm going to flip back to the board to be able to show you that. All right, so what is insulin resistance? What is insulin resistance? Let's do that. Insulin resistance. Insulin resistance. To be able to understand what insulin resistance is, it's important to understand what insulin does in the first place, okay? To be able to understand what insulin resistance is, important to understand what insulin does in the first place. Insulin is a very critical hormone in the body. It is the most important hormone in human existence, period. There is no hormone in the body that is more important than insulin. Insulin, I consider insulin to be hormone numero uno, uno in terms of importante, number one. And the reason why insulin is number one is because insulin dictates the smooth functioning of the body. Think of insulin as the CEO of the body. Sits right there at the tip, the CEO that dictates the functioning of the body. So insulin is a CEO. Insulin is the CEO of the body. CEO. and it dictates the smooth functioning of the body. Smooth functioning. Why do I call insulin the CEO of the body? Why do I call insulin hormone numero uno in terms of importante? Why? This is the reason why. It comes because of what insulin does. This is what insulin does. The job of insulin is to do this. Is to mobilize glucose. This is what insulin does. The job of insulin is to mobilize glucose out of the blood. You see, when we eat, all the food that we eat after absorption occurs is converted into glucose and is released into the blood. So the job of insulin is to mobilize glucose out of the blood into the cell. This is the cell. Mobilize this glucose out of the blood into the cell. Okay? When insulin gets into the cell now, when glucose gets into the cell at the command of insulin, glucose is now shunted through the mitochondria, shunted into the mitochondria. The mitochondria is considered to be the powerhouse of the cell. Okay? Shunted in the mitochondria. In the mitochondria, the glucose goes through a complex series of reactions called the electron transport chain, with the end result of that being the release of a molecule called ATP. ATP is an energy molecule. Okay, ATP stands for adenosine triphosphate. And it is energy. So that's what insulin does to the body. It helps to secure energy. So I'll take it again. The job of insulin is to mobilize glucose out of the blood into the cell. Glucose gets into the cell, goes through a complex series of reactions, the electron transport chain, resulting in the production of energy. So why do I call insulin the CEO of the body? You know, why do I call it hormone numero uno in terms of importante? This is why. Because without insulin, you cannot make energy. Without insulin, we cannot make energy. And every system in the body, every cell, to function requires energy. ATP is the energy currency of the cell. If a cell needs to produce something to work efficiently, energy has to be dispensed. So you can now see how the lack of energy, because insulin is not functioning properly, can cause critical systems to become out of whack, breakdown. That's why insulin is the CEO of the body. Without insulin, you cannot make energy. I'm going to flip over and make sure that you guys are following so far. Do you all follow? Do we follow? Do we follow? Are you all following me so far? Is that good? I'm going to get along, and I want to make sure that you guys understand and you're following. If you understand and you're following, great. I don't want to speed through this information. I want to break it down as slowly as I possibly can and make sure that you guys are all with me. So from time to time, bear with me. I'm going to ask you, do you follow? You could just drop a comment, yes or follow. That lets me know that you're following and lets me know that I am not going too fast. Okay, I'm going to put up another slide here. And this other slide, all right, this other slide shows the 7 energy dependent functions of the cell. The 7 energy dependent functions of the cell. That other slide. 7 energy dependent functions of the cell. Remember, I say we need energy to be able, the cell needs energy to be able to function. Our cells need energy to be able to function. When you do not have energy, the cells cannot function well. So insulin, the job of insulin is to secure energy. When you do not have the energy that the cells need, those 7 energy dependent functions of the cell, cannot, the cell cannot do. Some of them make proteins, repair DNA, cell signaling, transport, homeostasis, cell cleanup, as well as chemical reactions. If you do not have the energy, to do those 7 functions, then you have a disease process. And these are some of the diseases that you will have, when you have a lack of energy. Before I put up some of the diseases that you can get when you have a lack of energy, let me explain to you guys. I'm going to use one example. You see that list right up there? The very first one says make proteins, okay? So we need energy to make proteins. When we do not have the right energy to make certain proteins that the cell needs, the cell cannot make those proteins. Hold that thought. I want to show you guys, first of all, I'm going to stay on this board, talk to you guys now about what insulin resistance is. And then after talking to you about what insulin resistance is, I'm going to show you how it now impacts us having the diseases. So going back to this, we said the job of insulin is to secure energy. So we said that insulin resistance and dysbiosis is one of the things that causes you to have diseases, the shortage of the metabolic dysfunction. What then is insulin resistance, right? What then is insulin resistance? We have understood what insulin does. Now, what is insulin resistance? Insulin resistance is when there is a breakdown in this process. When there is a breakdown in this process. Anything that causes a breakdown in this process we call that insulin resistance. Anything that causes a breakdown in this process is insulin resistance. So, if anywhere in this step it doesn't occur from this step resulting to this step, we say you have insulin resistance, a lack of energy. And when you have insulin resistance, it then results in a slew of diseases. And this slide is a slide of all the diseases that you can get when you have insulin resistance. All the diseases that can come about because of insulin resistance, and what I would say is this slide is not exhaustive, okay? Unfortunately, I do not have a slide big enough to be able to show you all the diseases that stem from insulin resistance. This slide right here that I'm showing you, is just a snippet of what insulin resistance does. So when you have insulin resistance, you have a lack of energy. You have a lack of energy. Why? If we go back to the board, you have a lack of energy. Why? Go back to the board. Remember that the job of insulin is to produce energy. So when you have a breakdown, you do not produce energy. And because all the cells in the body require energy to function, when the cells don't have energy, the cells malfunction. The simple definition of a disease It's a cell that has malfunctioned. And the number one reason why a cell malfunctions is the lack of energy. So that slide that you're seeing up there is just a depiction of some of the diseases that come as a result of lack of energy driven by insulin resistance. Does that make sense so far? Does that make sense so far? If that makes sense so far, what I want to do now is I want to single out two diseases on there, okay? I want to single out high blood pressure and show you how high blood pressure is related to the lack of energy, insulin resistance. I also want to single out cancer. You see, a lot of people think that cancer is bad luck. But science has now shown more and more that most of the adult cancers that we face today are not due to bad luck. They're due to energy shortages coming from insulin resistance. So I want to pick out those two illnesses, high blood pressure and cancer, and show you how those two things are linked to energy shortages, insulin resistance. Let's flip back to the board. Now I'll just put that up there. Now, high blood pressure. So you generate your blood pressure from the artery, okay? There's some of you on here who are in the healthcare field. If you're in the healthcare field, you're a nurse, you're a physician, a pharmacist, or work in the hospital or anything, drop a comment in the chat, healthcare. Let me know what you do. I'm curious. I would like to know. So we generate our blood pressure from the artery, okay? This is how your artery is supposed to look like. Your artery is supposed to look like that, okay? That's our artery. Okay? The artery is just simply a tube. You generate your blood pressure from that. Now, inside the walls of this artery is a spacious cell called the endothelial cell, right here. Okay? It lines the walls of these arteries. It's called the endothelial cell. I'll give it its name, endothelial cell. Okay, now this cell has a special function to produce a very special protein or molecule called nitric oxide. Okay, nitric oxide, NO, abbreviated. So nitric oxide. The job of nitric oxide is to put his elbows out like this. That's the job of nitric oxide, elbow out. What do I mean by that? Nitric oxide, when nitric oxide is secreted by the endothelial cell, it comes to the wall of the blood vessels, elbow out, and expands the wall, the diameter of the blood vessels. So nitric oxide comes and acts right here, expands the diameter of the blood vessels and cause the blood vessels diameter to increase to now looking like this. Because of elbow out, the diameter of the blood vessel is now larger. Let's put it even here. Okay? Now, this tube with the diameter that looks like this, from here to here, that artery with the diameter that looks like this, compared to this artery with the diameter that is from here to here. The pressure in this artery, because it has a larger diameter, is gonna be lower. So P, pressure is gonna be lower in this artery because nitric oxide has come and opened the walls of the artery. Whereas the pressure in this artery that has a shorter diameter is going to be higher. So that's how nitric oxide causes us to maintain a normal blood pressure. But remember what I said though? Every cell in the body requires energy to function. This cell that makes nitric oxide The only way it's going to make nitric oxide is if it pays for it with ATP, energy. So when you have insulin resistance and you have a breakdown and you do not have sufficient energy, you now have low energy, you now have a shortage of energy available for this cell to be able to produce nitric oxide. So if normally, let's just use the word E for energy here. If normally the energy that was delivered to this cell every day to make nitric oxide was 100 energy units, and it needed 100 energy units to make 100 of nitric oxide molecules, and that 100 of nitric oxide molecules is supposed to go and cause this scenario. Now, if you have insufficient energy now, and instead of 100 energy molecules, it is short of energy because of insulin resistance, and it only has 50 energy molecules. Those 50 energy molecules can only secure 50 nitric oxide, If you need 100 nitric oxide to cause this diameter to be this wide so that you have a low blood pressure, now you have a deficiency of energy that you have 50 energy molecules that only cause you to produce 50 nitric oxide. The diameter of this blood vessel, since nitric oxide is to do this, nitric oxide can only elbow out 50%. If nitric oxide can only elbow out 50%, let's take 50% of this dilatation. 50% of this is going to look like this now. You're going to have a blood vessel that looks like this. That's 50% of elbow out that nitric oxide will cause here. That 50% of elbow out that nitric oxide will cause here, because the diameter of that blood vessel is now smaller, the pressure in that blood vessel is going to be higher. P is going to be high. And that's how you get high blood pressure, because of insulin resistance. I'm going to flip over and make sure that we are with me following. So you guys follow so far? Do you see how insulin resistance can result in high blood pressure? Follow so far? I'm going to now, are you with me? Are you with me? Are you with me? Great. Thank you, warrior. So as simple as that, that cell, the endothelial cell, because it became deficient, thank you, Robert, thank you, Noah, because it became deficient. Brother Nature is asking, how do you reverse high blood pressure? Brother Nature, stay with me. That's why I'm talking about this. I'm going to be able to help you understand how to reverse your high blood pressure using this. Stay with me. That's why I'm teaching this. Now, that's how insulin resistance results in high blood pressure. Let's talk about cancer. Cancer, as I say, most people think that cancer is bad luck. But I'm here to tell you that cancer is not bad luck. Cancer is the result of energy deficiency, metabolic dysfunction. Let me show you how that happens. Let me show you how that happens. You see, our DNA is a double helix structure like this. I'll show you that. Our DNA looks like this. Okay, that's how our DNA is. That's our DNA. In our DNA, we have genes in our DNA. Genes in there. Those genes help in the coding of every single thing that we need in the body. whether it's a nerve ending, whether it's a protein, whether it's an enzyme, whether it's a hormone, whether it's a receptor, whether it's a neurotransmitter like serotonin, all of those things that our body needs to function, they are coded in our genetic code, the DNA, and it's right in here like that, the DNA code for that. Now, for this code, this is a code to translate. Let's say, for example, let's take the hormone progesterone, or let's take a common hormone that we're talking. Let's take the hormone insulin even. Let's take the hormone insulin. Insulin doesn't just appear in the body like that. It has to be produced by decoding the genetic code. So let's say this genetic code right here is going to help to produce insulin. Something has to happen in the body we call protein synthesis. And for protein synthesis to happen, this code, when it's in this helix, it is protected, it is shielded. That helix has to open up for the code to be exposed and transcribed or interpreted. So for insulin to be produced by this gene, you have to have the decoding of the gene. You have to decode the gene. And to decode it, you need to expose the gene. And so to expose it, this DNA strand is now going to change from being double helix. If the gene for insulin is in this area, it's going to now unwind in that area, and then expose the genes that are there. And then the other places will remain the same. So it exposes this spot where the gene for insulin is. And then an interpreter comes here and interprets the genes here and then makes insulin. So every single thing in the body, every protein will go through this process. So what I mean is the DNA code then, your double helix, is constantly, in the wind state and unwind. Wind, unwind. Wind, unwind. Wind, unwind. That repeated movement, open and close, open and close, open and close, results in wear and tear. Wear and tear translates to the DNA is DNA damage. When you have DNA damage, if that DNA damage is not corrected, that DNA damage then propagates into a cancer. Fortunately, the body has a means to repair DNA damage. Many of us have suffered DNA damage but never suffered the repercussions because our bodies has deployed the DNA damage system to repair it, and we never know about it. It never manifests. DNA damage repair requires energy. To repair a damaged DNA, you need energy. When the body doesn't have the energy it needs to repair that damaged DNA, that damaged DNA now propagates into a cancer. That is how insulin resistance resulting in energy deficiency can increase your risk of having cancer. A lot of the adult cancers, colon cancer, prostate cancer, what have you, are as a result of a lack of sufficient energy that has made it impossible for DNA repair to occur on a damaged DNA. I'm gonna flip over and make sure that you guys are following so far. So I spent some time on there, to give you that one-on-one, a busy fingers hello, to give you that one-on-one information on that. Now, what I want to do is to now explain to you, how you develop insulin resistance. I'm gonna spend a little bit of time here. Can fasting heal STDs? No, fasting wouldn't heal STDs. Sorry. You need an antibiotic for that, but fasting wouldn't heal STDs. When I want to now spend a little bit of time to explain to you how you develop the breakdown in insulin resistance. Because when you understand that, then when I start explaining to you about a nutraceutical tool that can reverse that, your understanding of how the breakdown occurred is going to help you understand how this fits in reversing that. So I'm going to go back to the board. And I'm going to put this back on the board just as a reminder for us. If you're just joining us, my name is Dr. Dieter. We're talking about how our chronic medical conditions today as a result of energy shortage coming from two things, insulin resistance and dysbiosis, that cause us to have all the chronic medical conditions. And I'm going to talk about how we could reverse that energy shortage with a nutraceutical product. We're going to talk about how we reverse that energy shortage with a nutraceutical product. And reversing the energy shortage can cause your diabetes to go poof, gone. Your blood pressure go poof, gone. Your high cholesterol go poof, gone. So let's go back and recap, especially for those of you who just joined, what insulin resistance is, talk about the breakdown, and then we'll talk about how the breakdown occurs. So I said insulin is the most important hormone in the body, hormone numero uno, because it helps secure energy. And if you will recall, I said the job of insulin was to mobilize glucose out of the cell, out of the blood, into the cell. So glucose, by the command of insulin, goes into the mitochondria, goes through a complex series of reactions with the end result being an energy molecule called ATP. So insulin helps to secure energy. So insulin is very critical because without insulin, you cannot make energy, and all the processes in the body require energy to function. If you follow so far, drop a comment, follow, or gas, or move on. And I said that a breakdown, what then is insulin resistance? What is insulin resistance? It's a breakdown in this process. A breakdown in that process. That's a quick recap. All right, so that's insulin resistance, a breakdown in that process. How did the breakdown occur? How did the breakdown occur? You see, if you have a car and the car breaks down and you take it to the mechanic, what's the first thing that the mechanic does when you take your car to the mechanic shop when it has broken down? What's the first thing the mechanic does before he starts fixing the car? If your car breaks down and you take it to a mechanic, what's the very first thing the mechanic does? I would like to know your thoughts. Anybody? Anybody? Any guesses? Or do you agree with me that if you agree, I'll get alternator or open the hood? Okay, yeah, they open the hood. Diagnosis, correct. Diagnose. Alexander, thank you for that. That's what I was looking for. So they're opening the hood. Why are they opening the hood? They're trying to find out what happened. Okay. But the real thing is, yes, busy fingers, African braiding, correct. Find out the problem. Make a diagnosis. Okay, your car broke down. How did the breakdown occur? Because if the mechanic knows how the car broke down, what caused the breakdown, what caused the problem, then the mechanic knows how to fix it. So I'm going to take the same approach right here. I want to explain to you guys how the breakdown of insulin resistance occurs. We said insulin resistance is a breakdown in this process. I'm going to act like a mechanic now and talk to you. How did this breakdown occur? And the breakdown occurs in two ways. There are two ways in which we develop insulin resistance, and I'll explain that to you. Those two ways are, one, too much fat, and the other one is too much insulin. Too much fat, too much insulin. These two things result in insulin resistance. Number one, too much fat. And the first thing causes the second thing, too much insulin. Now, fat is good, but too much fat is not good. Insulin is good, importante, very importante, but too much insulin is not good. Ever heard of the saying, too much of a good thing is a bad thing? It's true, it really is. We need fat. The body has two sources of energy. One of our source of energy is glucose, our other source of energy is fat. The body uses glucose and the body uses fat, all of them to make ATP. There's a process which the body uses all of this to make ATP. The body makes ATP with energy with these two things. ATP is energy, if you will remember. ATP is energy. So the body uses those two things. Now, when we are in a fasting, when we are in a active state in the daytime, we are active, our metabolism is high, we're eating, the amount of glucose in the blood is high. Glucose, think of glucose as your check-ins account, okay? The body is going to use glucose as its check-ins account to take care of all the energy needs. Okay? At nighttime, what happens is that our glucose levels are low, our activity is low, we're sleeping, we're fasting, our glucose levels go low. So 80% of the body's energy needs are glucose, the other 20% is fat. So when glucose goes low at nighttime because our metabolic demand or our metabolic activity is low, the body could no longer rely on glucose. So the body now has to switch to burning fat, okay? Body has to switch to burning fat. So fat is important. So the body makes that switch to burning fat. So we need fat. The point I'm trying to make is fat is good because it's an alternate source of energy. And fat is like the savings account. Think of fat like the savings account. Your savings account. And I said think of glucose as your check-ins account. So when your glucose, when your checking account now goes low, at nighttime, and the body needs to spend to continue for all the cellular processes to go on, because at nighttime you still need to breathe. At nighttime your brain is still working and all that. All those things still need energy. So now, because the check-ins account is now low, the body now goes and switches to the savings account to get energy. I need to, just like you, when your check-ins account has run dry, you move now to your savings, to use your savings. That's what the body does. Thinks about glucose, fat, check-in savings. So we need fat. Fat is important, to be able to give us energy when our check-ins account is low. So now, too much fat is a problem. How does too much fat become a problem? Put it this way. We eat way too much calories than we're supposed to. When we consume food, any excess calories we consume is converted into fat. Let me make sure that you guys are with me so far. How is my speed? Is it going okay? Am I moving too fast, or is the pace okay? If the pace is okay, give me a thumbs up. If you want me to slow down, put in an S, I'll slow down. Okay, pace okay, perfect, thank you, wonderful. Mona, wonderful. Warrior is okay, wonderful. Emmanuel, wonderful. Janice, thumbs up. Thank you, thank you, thank you. Okay, Dora, thumbs up. Thank you for the feedback. Okay, now, how does too much fat result in insulin resistance? When we eat all the calories that we eat, the body takes all those calories and converts them into glucose, okay? To use for our energy. Any excess calories that the body doesn't need, the body takes a little bit of those calories and stores them as healthy fat so that we can use it, when our checkings account is low. Any excess calories that the body doesn't need, the body now takes those excess calories and converts them into fat. I'll convert it to, I don't need this, it converts it into fat. Any excess calories that it cannot put, where it normally puts fat, it takes that excess calories now and goes and lumps it into the cell. Normally a cell is supposed to look like this. But when you consume too much calories, more than your body needs, and the body converts those excess calories into excess fat, the body doesn't know where to put that excess fat. It comes and stores that excess fat. I'm just going to make a replica of this cell. It comes, so normally this is how that cell is supposed to look like. Now you've consumed too much calories, which have been converted into excess fat. That excess fat, the body doesn't know where to put it. It goes and lumps that excess fat here in this cell. Okay? It lumps that excess fat in this cell. And that is no bueno. Why is that no bueno? Because remember, the job of insulin, you have glucose in the blood. The job of insulin is to cause the cell to take up glucose. So for this cell that is looking normal, insulin can come and knock at the door of this cell and tell this cell, hey, I want you to take up glucose, and the cell takes up glucose because the cell has space in it. But when insulin comes to this cell is what I call a fat-laden cell. It is pregnant with fat, and it should not. This fat has no business occupying the space in this cell, but you have gotten it from chronic overnutrition, eating more calories than you're supposed to. It now comes and crowds that cell. Now, when insulin comes to this cell and knocks on the door of this cell, knock, 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 hey cell, I got glucose in the blood. I want you to take it up so that we can make ATP. You know what the cell tells insulin? You know what the cell says? It says, insulin, buddy, I got no room in my inn. I'm filled with fat. If I open my doors to glucose, where am I gonna put it? I am laden with fat. I have no room. And so the cell tells insulin, sorry, no room in the inn. So glucose cannot enter the cell. That's a breakdown. Insulin resistance. Why? Because of this. If glucose cannot enter the cell, it cannot go through the electron transport chain for you to make ATP. And this cell is acting like somebody on Thanksgiving who has had too much to eat. How many of you guys are looking forward to Thanksgiving? If you're joining us from America, Thanksgiving is next month. Thanksgiving is some of you all's favorite holiday. If Thanksgiving is your favorite holiday, drop a comment in the chat. Thanksgiving. Christmas is coming around. Well, the next holiday coming around, I guess, is Halloween. Halloween is some people's favorite holiday. For kids, I can get it. For adults, Halloween being your favorite, I don't get it. But hey, to each his own. If Halloween is your favorite holiday, drop in Halloween. Anyway, the point I'm trying to make The point I'm trying to make is, if you eat too much on Thanksgiving, you feel stuffed. How many of you guys have ever overeaten on Thanksgiving? If stuffed. If you have, drop a comment, stuffed. I have, not once, not twice, a few times. And it's just a yucky feeling to just feel so full. You feel disgusted with yourself that you ate that much. You just feel ugh. And if you had that Thanksgiving stuffed feeling, drop stuffed in the chat, and you understand what I mean by this. When you feel that stuffed, the last thing in the world that you're thinking about is to bring in another bite of anything else and put in your mouth to go in your belly. Even if that bite is your most favorite pecan pie in the world, you are so stuffed, is the last thing in the world that you'll bring into your mouth. That is exactly how this cell is feeling. You see, the cell thrives on glucose. The cell depends on glucose to make energy so that it could survive. So glucose is the cell's favorite thing to eat, the most favorite thing to eat. But the cell is so full with fat. It's fat laden. It's like that guy, a girl or person on Thanksgiving that's eating so much. And even their most favorite pecan pie, they feel so stuffed. The last thing in the world is putting their favorite pecan pie in the mouth. Nah. That cell is so full. The last thing in the world it's thinking about is bringing in glucose. That's the last thing in the world. It's so full. It has no space. It tells insulin no. And glucose accumulates in the blood. Understanding the cell, will you blame the cell? If you felt stuffed on Thanksgiving and you don't want to have anything else to eat, do you blame that poor cell for feeling stuffed and not being able to, not being able to get glucose in? I don't blame it. If you don't blame it, say, I don't blame it. No blame. No blame. Insulin resistance. I'm going to flip over, make sure that you guys are following. Make sure that you guys are following. Yes, no blame, no blame. So that's the first way in which you develop insulin resistance. The second way in which you develop insulin resistance is too much insulin. Yeah, I won't blame the cell. You're right. The second way in which you develop insulin resistance is too much insulin. You see, there is a one-to-one relationship between glucose concentration and insulin concentration. When glucose concentration is high, insulin concentration is high. When glucose concentration is low, insulin concentration is low. Say it again. When there's the amount of glucose in the blood is high, the pancreas has to produce a commensurate high amount of insulin to deal with it. And that is how, we will factor, you will see how too much insulin causes insulin resistance. I'm going to explain that right here. Now look, this cell is now fat laden and cannot take up glucose, and glucose is accumulating in the cell. Okay, in the blood, sorry. That glucose that accumulates in the blood is now a trigger for the pancreas to produce too much insulin. Too much insulin is no bueno. Remember, I described insulin like the CEO of a company that dictates the smooth functioning of the company. Insulin is that important. But too much insulin is like a bully. It's like a CEO of a company that was initially level-headed that becomes cuckoo. He goes off. He comes to work one day. He's backing orders, unreasonable orders, yelling in the hallway, pulling people's shirts, saying to people, firing people left and right for unreasonable reasons, telling you you're going to do it my way or the highway. He has just gone out of character. being tyrannical and a bully. Now, if you had a boss like that who was initially level-headed, right? Who dictated the smooth functioning of how things go at work, and all of a sudden that boss becomes cuckoo, you're going to lose your respect for that boss. If the respect you had for the boss was initially right here, when the boss starts acting out of character like that, your respect for the boss goes from here to here. Do you agree? Do you agree that a boss like that will cause you to lose your respect for them? If you agree, drop agree. Now, when you lose a respect for your boss, let me ask you guys this question. If you initially respected your boss and then you lose respect for him because they are him or her because they are acting out of character, is it harder for you to do what that boss tells you to do, or is it easier for you to do what the boss tells you to do when you have lost respect for the boss? Let me get some answers. I lose my respect for my boss, and my boss tells me to do something. Is it easy to do that thing, or is it harder to do that thing when I've lost respect for the boss? Let me get some answers. I'll flip over. Harder. Of course it's harder. Of course it's harder. Yes, it is harder. It is harder. And the reason why that is, it's just human nature. It's human nature. It's hard to respect. It's hard to do something for somebody that you do not respect. So let's say I am an A game person. When I go to work, I bring my A game. Bring it. I bring my A game all the time. And I've lost my respect for my boss man. And my boss man comes to me and say, hey, Dr. Dieter, we have this project that is due in 30 days. Can you do so and so to get it over the line? But I've lost my respect for the boss. I hear that I immediately have a grumbling spirit, you know. I don't want to do anything for him. But I know if I don't do it, I'll lose my job or whatever you. But I decide this is what I'll do. Instead of bringing my A game to that project, I'll bring maybe my B plus or my C game to that project. Because, you know, I don't have the motivation because I have lost respect for my boss man. Let's translate to the cell. That's exactly what happens to the cell. When insulin is running too high, too much insulin to the cell now becomes like a boss that the cell has lost respect for. When insulin is too much, insulin is a bully and a tyrant to the cell, terrorizing the cell, yelling at the cell, say, you must do this, you must do it. When I want you to do it, you must do it. How I want you to do it. No ifs, no ands, no buts. The cell hears that high tone of insulin and like, I can't deal with that. No, I can't deal with that. The cell loses its respect for insulin. Now, when the cell loses its respect for insulin, the cell finds it hard to do the number one thing that insulin asks it to do. And what's the number one thing that insulin asks the cell to do? Hey cell, I want you to take up glucose from the blood so that we could make energy. So when insulin comes and knocks at the door, the cell has lost its respect. If the door was this open, the cell closes the door even more. It may do it, but do it like that. It closes the door. So less glucose comes into the cell because the cell has lost respect for insulin. It closes its door. When the cell closes its door because of a loss of respect, more glucose accumulates in the blood. When that more glucose accumulates in the blood, it's a trigger. Remember, there's a one-to-one relationship. When you have high glucose, the pancreas is going to produce a commensurate high amount of insulin in the blood. And that causes the pancreas to produce even more insulin. Even more insulin is like a CEO who was cuckoo at this level and raises their cuckoo-ness, their craziness to this level. Okay? The cell loses even more respect for insulin. When the cell loses even more respect for insulin, the door that was closed like this gets closed even tighter. And this process and glucose continues to accumulate in the blood like that. So you're just having, you see where I'm going to with this? You're just having a vicious cycle. A vicious cycle, you know. And that's how too much fat and too much insulin result in insulin resistance. Remember, insulin is important, but too much insulin is like a CEO that has gone crazy, gone nuts, a boss that has gone nuts, and the cell loses respect for it. Now, let's move to I want to make sure that you guys are with me so far. You're with me so far. We're going to now move to the second thing, dysbiosis. What is dysbiosis? Remember I said that there are two things that cause us to have all the chronic medical conditions that we have. And those chronic medical conditions as a result of energy shortage. Insulin resistance is the one of them that contributes to the energy shortage. The other thing is microbiome dysfunction that contributes to energy shortage. Let me go ahead and put this on here. And then I'm going to show you guys, I'm going to explain to you guys what the microbiome is. First, we're going to talk about what dysbiosis is. Okay? We're going to talk about what dysbiosis is. Dysbiosis is a situation where you have bacteria in the gut that is out of balance. But let's hold that thought. Let's come to here. I want to talk about the microbiome, because when you understand what the microbiome is, you're going to understand what dysbiosis is. So let's talk about the microbiome. The microbiome is, I want to make sure, the microbiome is, the microbiome is a population of bacteria that live in our gut. Okay, so now we're talking about what dysbiosis is. And we're talking about the microbiome. So did you know that they are about, so what is the microbiome? Did you know that there are about 30 to 100 trillion bacteria that live in your large intestine? 30 to 100 trillion bacteria that live in your large intestine. Those 30 to 100 trillion bacteria that live in your large intestine are called the microbiome. Now, God in his infinite wisdom put this in our gut for a purpose, the microbiome. Put this bacteria population in our gut for a purpose. Our Creator in his infinite wisdom put that bacteria in our gut for a purpose. We're supposed to live with this bacteria in the gut in a symbiotic relationship. What I mean is a do for you, I do for me. Scratch my back, I scratch yours. Or if you may say, quid quo pro. We do for them, they do for us. What we're supposed to do for them is that we're supposed to provide them shelter, a place to stay, and we're supposed to provide them food, okay? And then in turn, they do all of these functions that you see up on the chat. All of those functions that you see up in the chat, in the slide, the microbiome does. So I'm going to explain each of them one after the other for you to understand. Just give me 1 second. It's getting a little bit steamy in this room. I'm going to just turn the AC on. I'll be right back. I'm not done yet, but it's just hot. Okay, I'm back. Just making sure. So let's go through all the functions of the microbiome here. So that slide you see up there, number one, it talk about it helps with fiber, to digest fiber. Fiber digestion. My kids have ruined all of what I have. That's the first thing the microbiome does, fiber digestion. And the food for the microbiome is fiber, okay? The second thing that it does is it helps to protect the gut. From bacteria, from disease-causing bacteria. Helps to protect the gut from disease-causing bacteria. And it does that by producing a special postbiotic called the short-chain fatty acids. You've heard of prebiotics. You've heard of prebiotic. You've heard of probiotics. Now I'm talking to you about postbiotics. It produces a short-chain fatty acid. Now, this short-chain fatty acid goes and protects the gut. Okay? Short-chain fatty acids are only produced, by the microbiome. Only produced by the microbiome. Only produced by, the microbiome. These organisms right here. Only. You cannot get it from eating any food or consuming anything. And what those short-chain fatty acids do, they go and maintain the strength and the integrity of the colon wall. So the cells of the colon, I'm going to flip over like this and explain it to you guys like this. So the cells of the colon are linked together, cell like this, cell to cell, cell to cell. Like you see my knuckles right here? That makes the wall of the colon, cell to cell, cell to cell. So it's tight right here so that stuff cannot escape. Those short-chain fatty acids come and cause my knuckle edges right here. They come and cause the security at my knuckle edges to be even tighter so that stuff doesn't leak out, so that the wall is not weak. If the wall is not weak, bacteria cannot seep in through the leakages. So the short-chain fatty acids, what they do is they keep the junction very tight so that stuff doesn't leak out and go into the blood. Okay? So that's one of the ways it helps to protect the gut from pathogenic bacteria. The other thing is that it helps to train the immune system. It helps to train the immune system. Did you know that? Let's make sure we're with me. Did you know that 70% of the body's immune system resides in the gut? 70 resides in here in the gut. 70% of the body's immune system. Then I write it down here. So 70% of the body's immune system resides in the gut. 70% of the immune system is in the gut. The other 30% of the body's immune system resides in the bone marrow, the lymphatics, the lymph nodes. 70% remember is in the gut. And so that's why the gut or the microbiome is in charge in training the immune system. And let me explain to you, that is such an important task that your gut has in training the immune system. And I want to flip over and explain to you why that is such an important task. You see, there are two ways in which the microbiome trains the immune system. Two ways. in which the microbiome trains the immune system. It could train the immune system to be healthy, or it could train the immune system in an unhealthy way. That you see, our immune system is our defense. When we are sick, the immune system deploys a response to fight what is going on. If there is an invader in our blood, a bacteria, what have you, the immune system deploys. So what happens is this. When the microbiome is healthy, right, it trains the immune system in a healthy way. And a healthy reaction, a healthy training to the immune system looks like this. Hey, you see that bacteria right there? That dude is a bad dude. Take him out. But you only just need a handgun to take him out. Just a simple handgun, you will. You see that other bacteria there? You could just use a David sling, to take him out. You don't need anything crazy. Now, you see that other one out there? You need a little bit of firepower. Use a grenade for that one. And then tell the immune system, now you see that guy right there? What guy? That guy. What guy? That guy right there. Look, that guy right there, he's in camo. He's in camouflage. He is not a bacteria. He may look like a bacteria, but he's not a bacteria. He's in camo. Don't attack him. He's part of the body's cells. Don't attack him. That's a healthy training to the immune system. An unhealthy training to the immune system when the microbiome is unhealthy is that it trains the immune system to have a trigger happy finger, to shoot first and ask questions later. And it trains it to overreact even when it has a good reason to kill. So for example, if it sees a bacteria and is on, it will tell the microbiome, hey, you see, the microbiome will tell the immune system, you see that bacteria there? You could probably take him out just with a single shotgun. But why use a shotgun? Just use an AK-47 for kicks. It's much fun. Whereas a single one bullet could have taken him out. That is an unhealthy microbiome training the immune system to be hyper-reactive. The second thing is that it could train the immune system now to attack cells of the body. You see that guy right there? You see him? It looks like he's in camo. I don't know whether he's in camo or not. You know what? Just blow his head off. We're going to do an autopsy later and see whether he's part of us or not. So the immune system blows the head off of somebody who was in camo, and that person in camo is part of you. It's on your team. It may be a cell of the neck, a cell of the colon, or what have you. So the immune system has now been trained to shoot first, ask questions later, and now attacks the body. And therein lies how you develop autoimmune diseases. So if you have an autoimmune disease, lupus, Hashimoto's, celiac, it comes as a result of your gut being unhealthy. When your gut is unhealthy, it trains the immune system to be hyper-reactive, to have a trigger-happy finger. The last thing on that list, do you guys follow so far? Yes, it's amazing. It's crazy. If you follow so far, drop a comment in the chat, follow, to make me know that we're doing well. And the last thing in that is that the microbiome helps in the synthesis of B vitamins and B vitamins and K vitamins. Okay, thank you. B vitamins and K vitamins. That's the last thing the microbiome does. I'm just gonna write that on the board really quickly, and then I'm gonna tell you guys something that tell you a very short revelation that recently came out. So in the synthesis of vitamins. All right. So that's how important the microbiome is. There was a scientist who recently did a study in Tanzania, a Dutch doctor, infectious disease doctor, who has worked for so many years in Tanzania. He just recently came out with a study. This is what he found. Remember, the microbiome trains the immune system. The immune system attacks by deploying an inflammatory response. That's how the immune system helps to protect us. This Dutch scientist, who is an infectious disease doctor, he said 20 years ago, he's gone back and forth and done research, in the major university there in Tanzania. He realized that 20 years ago, the most common diseases in Tanzania that were killing people were infectious diseases. The malaria, the typhoid, the cholera, the salmonella. Those were the things that were causing deaths. He recently went back to Tanzania this year and realized that the most common diseases that people are now dying from, causing majority of the diseases, the morbidity, the death, is the diabetes, is the stroke, is the high blood pressure, is the obesity. And he asked himself, what has happened that 20 years ago, the diseases that used to kill people were the infectious diseases, and we never had these diseases. But now, in today's day and age, the non-communicable diseases, the non-infectious diseases, are the ones that are ravaging Tanzania. I'll flip over. And so he postulated that this is what he postulated, that it has to do with the food. That's what he thought. It has to do with the food. Because what he realized was that the people who lived in the rural areas close to the foot of Mount Kilimanjaro were healthy, did not have the obesity, the diabetes, the blood pressure, and all of that. Whereas the people who lived in the cities in Tanzania were obese, the diabetes, the blood pressure, and all of that. So he said, it has to be the food, what they are consuming. So you know what the scientist did? He took a group of people from the city and he relocated them to the rural areas for 2 weeks. And he took a group of people from the rural areas at the foot of Kilimanjaro and he relocated them to the city for 2 weeks. So the people who he took from the city and relocated them to the village, for those 2 weeks, he fed them only foods that the rurals ate, the locals ate. All whole natural foods that the people locally in the rural area, the foot of Kilimanjaro, ate for 2 weeks. The people who he had relocated them to the city, he fed them only foods that people in the city ate. All the type of foods that the people in the city ate. And then he tested their blood. So he tested their blood before, and then after the 2 weeks, he took lab tests and tested their blood. You know what he found? He found that the people in the city who he had relocated to the rural areas, the foot of Kilimanjaro, and fed them only the rural foods, their inflammation numbers, their immune system hyperactivity or inflammation markers went from this level to this level in 2 weeks. Isn't that amazing? What we eat, their inflammation level went from here to here. The opposite is true. The people who he took from the village and relocated them to the city, in the 2 weeks that those people ate city food, their inflammation levels went from this level to this level. Their immune system was hyperactive from here to here in 2 weeks. That is what the microbiome does. Now, what is then microbiome dysfunction? Dysbiosis. Dysbiosis is when you have an imbalance in your microbiome. Going back to village food. Beatrice, do it. Go back to village food. Do it. It secures your health. So dysbiosis is a situation where the bad bacteria increase in number, and the bad bacteria increase in number, and the good bacteria decrease. Now, In the gut, the good and the bad bacteria live together in a 50-50%, population. 50-50% population, the good and the bad, they keep each other in check, okay? Now, you have this dysbiosis when the good bacteria, the bad bacteria become too high and the good bacteria go low. The question is, why does that happen? That happens because of our food or what we eat. You see, I said that the food for the microbiome, for the bacteria in the gut, is fiber. And we do not consume enough fiber today. In our modern age, we're consuming less fiber than our ancestors did. Our ancestors probably ate about 80 grams of fiber a day. We're consuming about 10 to 12 grams of fiber today, okay? About 10 to 12 grams. Fiber is food for the microbiome. You see, every living organism, whether it's a lion in the jungle of Cameroon, where I'm from, or a bacteria living in your gut, as long as it's a living organism, it needs food, it needs nutrients. And the bacteria in the gut, their food is fiber. So when there is a shortage of fiber, shortage of food because we're not consuming enough fiber, what happens is that in the period where there is now a shortage of food because we are not consuming enough fiber, the bad bacteria hoard the food, okay? The bad bacteria take the little fiber that is there, it sets into, in the situation where there's shortage, survival of the fittest sets in. It's just like, when there is an emergency, a hurricane, if you live in a hurricane area, you want to go to the grocery store, all the bread on the shelf has been swept, all the water on the shelf has been swept. So when there is shortage, that emergency like that, survival of the fittest sets in the gut, the bad bacteria hoard the little fiber that is there, the little food. And then to keep a hold on the fiber, they say, let us go ahead and increase our army, so that we can keep a hold, a grasp, a monopoly on the little food. So the bad bacteria go high, the good bacteria go this. So instead of having a 50-50% population, you now are lopsided like this. And that lopsidedness is called dysbiosis or microbiome dysfunction. And when you have dysbiosis, it causes you to have these issues, okay? These are the issues that will happen when you have dysbiosis. When you have dysbiosis, you can have heart disease, increased risk of colon cancer, increased risk of diabetes, anxiety, depression. If you see on there, you're going to see lupus. It's an autoimmune disease. It's the microbiome, trigger happy. Hashimoto's autoimmune disease, the microbiome, trigger happy. Celiac autoimmune disease, the microbiome, trigger happy. Over and over again, inflammatory markers are up. The microbiome is just ready to shoot first and ask questions later, destroying the cells of the body. Now, you may be surprised to see anxiety and depression on there. Anxiety and depression. How many of you guys are surprised to see anxiety and depression, on this slide, linked to the gut? If you're surprised, drop a surprise emoji or say surprise. I was, as a physician, I was surprised to learn that anxiety and depression are related to the gut. I was very surprised. Now, let me explain to you guys why anxiety and depression are linked to the gut. Yes, Dara, surprised. Nuwa, surprised. Let me explain to you why. I'm going to go to the board and explain. You see, I am depressed because I lost my mom. I'm sorry to hear that. Now, you see, there is a hormone called serotonin. There is a hormone called serotonin. Where is my marker? Serotonin is a hormone or a neurotransmitter. Some people call it a hormone. Some people call it a neurotransmitter. It helps in maintaining your mood. It's the hormone that helps you not to be depressed or have. People who have anxiety and depression, they usually put them on what you call SSRIs, serotonin secretion release inhibitor, to help to increase your serotonin levels. Okay, so did you know that this hormone, serotonin, 90% of this hormone, 90% of the hormone is produced in the gut? That's a big number. Big number. 90% of that hormone that helps to maintain your mood is produced in the gut. The other 10% of serotonin is produced in the central nervous system, the brain. 90% the gut, 10% the central nervous system. So really, the gut is the factory for producing serotonin. Now, if a factory is not working well or down, will the factory be able to keep up production of its product to maintain demand and supply? Heck no. And that's what happens when you have dysbiosis. When you have dysbiosis, the factory, the gut, is down. The gut cannot put out its product to maintain demand. And you have a low amount of serotonin, you have depression, you have anxiety. So a good chunk of people suffering from anxiety and depression can be linked to your gut. Now, I'm gonna flip over. Now, all of these things I have said, there is good news. There is good news because can you repeat? What do you want me to repeat, please? Let me know what you want me to repeat, and I will be glad to. Let me know what you want. Just repeat the whole thing. Okay. Okay, let's do it. Let's do it. Let's do it. All right. So what I was saying is that this hormone serotonin, it's a hormone. Some people call it a hormone. Some people call it a neurotransmitter. It is responsible for maintaining mood. It's the happiness hormone. It keeps you calm. It keeps you not depressed and what have you. That hormone, okay? You could call it a hormone. You could call it a neurotransmitter. It is responsible for maintaining mood, maintaining calm, happiness. It's the hormone that makes us, to be level, not to be depressed, down. Maintains mood and calm. What I was saying is that 90% of that hormone, 90% of that hormone is produced in the gut. 90%, a good bulk of this hormone that helps to maintain our mood is produced in the gut. The other 10% is produced in the brain, the central nervous system. Now, if you had a factory, so what that means is that the gut is the main factory for the production of serotonin. The gut is the main factory. Is the main factory. Is the main factory for the production of serotonin. So I'll flip over and I'll ask you a question. If you had a factory and that factory is supposed to be producing a certain amount of product to send out to the market, and that factory goes down, will that factory be able to meet demand? the factory goes down, will that factory be able to meet the demand to be producing the products that have to go to the market? The answer is no, right? Do you agree that the answer is no? If a factory is supposed to be making maybe, 100,000 tons of steel every day, and the factory goes down, you think that factory is going to be able to put out 100,000 tons of steel to send to the factory, to send to the market? No. It's the same thing with the gut. Because the gut is the main factory for the production of serotonin. The gut is the main factory for the production of serotonin. When your gut is not healthy because of dysbiosis, the gut cannot produce its product, cannot produce serotonin, enough serotonin. You now have depression and anxiety. Because the gut cannot produce that, you now have anxiety and depression because you have a shortage of the product that is needed to maintain your mood. Only 10% of this is produced in the brain. So that is it. That is how important your gut is, to your mood, anxiety, depression. I hope that makes sense. Did that make sense? Did you get that? Yes. Indeed, indeed, indeed. Now, there is good news, guys. There is good news. We now have science that shows that if you reverse the energy deficiencies that cause these issues, let's see. There is now science that says that if you reverse the energy deficiencies that cause these issues, the insulin resistance, and you reverse the dysbiosis, these diseases will go away. You reverse the disease condition. And that should be good news to us. That should be good news. Reversing insulin resistance and reversing dysbiosis is going to cause your disease to go away. Somebody say, what causes someone to be anxious by height even if there is a good? That's something different. That's a phobia. Phobias are different, right? You're talking about phobias. I have a phobia for height, so that's something totally different. And that's an acute issue, not a chronic issue. So if you reverse, if insulin resistance and gut dysbiosis cause you to have an energy shortage, and that energy shortage led you to have, a health problem, a disease issue. I am drinking, somebody asked me what I'm drinking. As a Wong Fani, I am drinking the product I'm going to teach you guys about, the Unomate. I'll talk to you guys about that shortly. This product, I'm drinking that. This helps you, to be able to reverse the disease conditions. I'll talk to you about that. So when you reverse the insulin resistance and the dysbiosis, those diseases that came as a result of that will go away. Remember, insulin resistance and dysbiosis cause an energy shortage. That energy shortage now leads to disease. I am pre-diabetic and trying to reverse it. It's reversible, and I'm glad you're listening to this because this can help you. Now, insulin resistance and dysbiosis results in energy shortage. That energy shortage causes you to have disease. Remember, I defined the disease as when you have a cell that has malfunctioned. And the number one reason that a cell malfunctions is because of lack of energy. So if you reverse that energy issue, the disease goes away. How many of you guys have ever ran out of gas before? If you have ever ran out of gas, and your car stopped on the road, if that's you, drop a comment in the chat, me, or ran out of gas. I have. The last time I ran out of gas was maybe around 2012. And I had to call a then girlfriend to come bail me out. She didn't find it funny. She felt very embarrassed. So when you run out of gas, your car stops, correct? Your car stops not because there's intrinsic failure of the engine. No. Your car stops because what has happened is that the power source of the car, the juice, the energy for the car is no longer there. The engine is working just fine, but the engine doesn't have the energy to function. It stops. Same thing as the body. When the body doesn't have the energy it needs, the cells do not have, it stops working. You develop disease processes. If your car stops and you walk to the nearest gas or fuel or petrol station and you get gas and you put in you get gas on a gallon and you walk back to your car on the road and you put gas in that tank. When you put gas in that tank and go back and sit in the driver's seat and turn on, the car starts again. The car starts again because its problem was not that there was intrinsic failure. Its problem was energy. Now that you restore the energy balance, the car starts again. You do not even have a thought. When you put gas back in the car, you do not even have an afterthought that, oh, is this car gonna start? No. It stopped because it ran out of energy. When I put gas in it, the thought doesn't even cross your mind. It is the same as the body. We have these diseases because of energy shortages. Just like that car that started all over again when you put gas in it, your body does the same thing. When you restore the energy balance or the energy shortage, that causes your diabetes, that causes your prediabetes, that causes your high cholesterol, that causes your sleep apnea, that causes your migraine, all those things now go away, just like that car started again. And that should be good news. And it is good news, and I want to share with you teaching this nutraceutical product. There is a nutraceutical product which is a solution to that. And the nutraceutical product, is called the Feel Great System. I'll put that on here, the Feel Great System. The Feel Great System is a nutraceutical product that I'm going to teach you guys. The name, one of them is called the Unimate. Let's see if I could. Unimate is one of them, and the other one is called Balance. Okay, I am drinking right now the Unimate. I'm going to talk to you guys about these two products, and what they do to reverse insulin resistance. So hang with me. These two products, and I'm going to go back and put that up here because I'm going to go to the board, help in the reversal of insulin resistance. Paul from the Caribbean, welcome. Thank you. All right. So I said you develop insulin resistance. We develop all these chronic medical conditions because of two things: insulin resistance and gut dysbiosis. So if we reverse those two things, those diseases will go away. And these two products help to do that. They're called nutraceutical products. They help to do that. I'm going to talk about them. And if you're in the healthcare field, any of you guys in healthcare, maybe you're a nurse, maybe you're a pharmacist, maybe you're a PA, maybe you're a doctor in the healthcare field. If you're in the healthcare field, you'll be interested to know that these two products are listed in the physician's desk reference. So the first product, the Unimate. And the second product is called Balance, okay? Let me just show you guys how, and then I'll flip over and I'll tell you what these two things do. But they are listed in the PDL, the physicians. I'm going to tell you where to buy that, Paul. Don't worry. I'm going to teach that, and then I'm going to show you where to buy that. So if you were to go to the physician's desk reference, if you went to the physician's desk reference, you're going to find these two things. You're going to find them there. The Unimate and the balance are listed in the are found in the physician's desk reference. So if you go to the physician's desk reference and you look for balance or you look for Unimate, you're going to find them. They're what we call nutraceutical products. If you went to the physician's desk reference, you know, this is the Unimate listed in the physician's desk reference. You can read about it, its health benefits and what have you. And if you looked further and you looked at the balance, you're going to see the balance in the physician's desk reference. So what are nutraceuticals? I want to first talk about what nutraceuticals are before I talk a little bit more about what they do. A nutraceutical is a product that is made, a nutraceutical, which these two things are, is a product that is made 100% from plants. Nutraceutical. It's a product that is made 100% from plants, you know, but has nutritional benefits. Made 100% from plants. In addition to nutritional benefits, has huge health benefits. So that's what these two things are. Okay, let's start by talking about the Unimate. And as I said, if you're in healthcare, you could go look at that in the PDR. You're going to find that. What the Unimate is, the Unimate is made from a plant that is native to South America, Brazil, Colombia, Argentina. Lionel Messi drinks the tea from that. It's made from this plant called the yerba mate plant. Okay, yerba mate plant. The yerba mate plant is very rich in a special phytonutrient called chlorogenic acid. Chlorogenic acid falls under the category of a polyphenol, and it has huge benefits for us. Huge benefits. Now, how does the yerba mate, this, because I said these two things help to reverse insulin resistance, you know, and help to reverse dysbiosis. How does the yerba mate help to reverse insulin resistance? This chlorogenic acid, you know, causes the body to burn fat. Lipolysis causes you to burn fat. So remember, the first way in which we develop insulin resistance is that you had this cell that was pregnant with fat, you know, and it was fat laden. And when insulin came to this cell and told this cell, take up glucose, the cell said no because he had fat filled in it. Well, the chlorogenic acid right here in the yerba mate, that this chlorogenic acid comes and causes, you know, fat burning. It causes you to burn fat burn. So when you consume the yerba mate, when you consume the Unimate, which is rich in the chlorogenic acid, which causes you to burn fat, it causes this cell that was filled with fat that could not take up glucose, that caused glucose to accumulate in the blood, to now burn fat, to burn the fat in there. And this cell now turns, after it burns the fat, it now goes back to looking like this, a normal cell, because fat burning has occurred. Fat burning. When fat burning occurs, this cell is now free to now take up all the glucose that it could not take up before. And that glucose that enters the cell can now result in making ATP. And that's what the Unimate does to reverse insulin resistance. That right there. Want to make sure that you guys follow. Do we follow so far how the Unimate helps in the reversal of insulin resistance? We follow so far. If we follow, drop a comment, follow. Say that again. Somebody wants me to say that again. Okay, let's do that. I'll say that again. Okay, for the purpose of somebody who wants me to say that again. So the Yucca mate is made from a plant that is native to South America called the yerba mate plant. That plant is very rich in a special nutrient called chlorogenic acid. The property of chlorogenic acid is to cause the burning of fat, cause you to burn fat, the body to burn fat, what we call lipolysis, burn fat. So when you drink the Yucca mate, which I am drinking, when you drink the Yucca mate, because of the property of the chlorogenic acid causing you to burn fat, if you did not catch this, the first part of the conversation of how you develop insulin resistance, this may not make sense. But because you developed insulin resistance first by having fat in your cell, when you now consume the Yucca mate, it causes you to burn fat. This fat in your cell that was preventing glucose from getting in the cell is now burned, and the cell now looks like this after fat burning occurs. It now frees up all the space in the cell for glucose to enter the cell, and then now you could make ATP. Now, this product here called the when that does that, it helps to reverse also the second way in which we develop insulin resistance. Because if you will remember, the second way in which we developed insulin resistance was too much insulin, the CEO that had gone crazy, cuckoo, okay? So you had too much insulin because when glucose accumulated, it resulted in the production of too much insulin, the crazy CEO. That was backing orders that the employees lost their respect for the CEO and did not do what the CEO wanted them to do, translate to the cell. When insulin was too much insulin, the cell lost its respect for insulin and closed its doors, and more glucose was accumulated. So when all this glucose now is taken up by the cell, now the concentration of glucose in the blood drops, okay? The concentration of glucose in the blood drops. When the concentration of glucose in the blood drops, you know, the production of insulin by the pancreas will also drop. So the pancreas is going to go from too much insulin to now producing low insulin. You know what low insulin is like? Low insulin is like this. Low insulin is like a CEO of the company that was initially, low insulin is like a CEO of the company that was initially cuckoo, you know, that now decides that, okay, I'm going to go to my employees and I'm going to apologize to them. That's what low insulin is like. It goes to the, give me one, it goes to the CEO goes to the employees and says, guys, I've been a jerk for the last 2 months. I'm sorry. Please, will you forgive me? If I had a boss that I'd lost my respect for and he came and apologized to me sincerely with a contrite heart, that he had been a jerk and asked me for forgiveness, you know what I do? I forgive that boss and I automatically gain my respect back for the boss again. If I gain my respect back for the boss again, it now becomes easier for me to do what the boss asks me to do, right? And so you translate that to the cell. I'll answer your question. Is it safe for someone allergic to caffeine? You could caffeine sensitivity, you know, is people acclimatize to caffeine sensitivity. Depends on what your caffeine sensitivity is. Many people who have been helping find that if they can decrease the dose. So for example, I have an aunt who is sensitive to caffeine. What she does is that she uses, so normally you're supposed to use this sachet in 16 ounces of water. So for people who have caffeine sensitivity, they can tolerate it. Instead of using the full sachet, use half a sachet and the same amount of water, or half a sachet to 32 ounces of water, double the amount of water. I lost my train of thought there. What was I talking about? I lost my train of thought there answering that question. So the CEO comes back to the employees and says, "Hey, I was a jerk. Please forgive me." Thank you, CEO. When the CEO says, "Please forgive me," it looks like this. It's like it's the cell. When the CEO says, "Please forgive me," the employee now gains his respect back. So if I lost my respect for my boss man and he comes to me with a contrite heart and says, "I'm sorry, I've been a jerk," I gain my respect back for that boss. And if after I gain my respect back for that boss, I go from giving the boss my C game to giving the boss my A game. You translate to the cell. When insulin now becomes low, insulin becomes like a CEO that has become level-headed. He's no longer a bully or a tyrant, to the cell. It's just like a bully on the playground, who has been bullying kids, who comes one day to the playground and say, "Hey kids, I'm sorry I've been a bully. Please forgive me." And kids are very forgiving. When a kid hears a contrite apology from a bully, the kid forgives and says, "I can work with him." Same thing with the cell. When insulin now becomes low, the cell now says, insulin has become humble. I can work with that humility. Insulin now, the cell now opens its doors and more glucose comes into the cell just because of that. And so that's how the Unamate helps to reverse insulin resistance. The other thing is the fiber. This product, the balance, is fiber. Fiber is very important in reversing insulin resistance. It does exactly the same thing. This is made up of fiber taken from multiple different plants. We do not consume enough fiber. Just by consuming fiber, you're going to help to reverse insulin resistance, bring your blood sugars down and all of that. So this fiber product does exactly the same thing in reversing insulin resistance. If somebody came to you and told you, "Hey, I can give you one person to paint your house, but the paint job is only going to be done 70% efficiently, but I can give you 2 people to paint your house and the paint job is going to be done 100% efficiently," you're going to want the 2 people. So that's how these two work. They work in conjunction to reinforce each other to give you a 100% performance. Now, the other thing that the balance does in reversing insulin resistance is that it brings down your blood sugars. It keeps your blood sugars to be low. And I'll explain it like this. Balance is fiber. It causes your blood sugar to be low. And when your blood sugar is low, it causes you to be more insulin friendly. Do you guys follow so far? We're almost coming to the end of this. I want to make sure that you follow. You follow, you follow, you follow. Are you with me? Are you with me? Are you with me? Do you follow so far? Can I hit the gas and keep on? Hit the gas and keep on. All right, thank you, thank you, thank you. So what you do here is I want to show you guys how this now helps you to reverse, helps you also, to reverse insulin resistance or to make your body more sensitive to insulin. The opposite of insulin resistance is insulin sensitivity. So I'll explain it like this. Fiber is very important for us because fiber helps to slow the transit of food through the colon. If, let's say, food is supposed to move through the digestive tract by this speed, fiber causes food to move through the digestive tract by this speed. The fast transit of food through the colon causes fast absorption. Fast absorption causes fast release of glucose into the blood. The slow transit of food through the colon causes slow absorption. Slow absorption results in the slow release of glucose into the blood. How does that factor in? How does that translate? Let's say you and I are feeling like eating some pasta. You know, we go to our favorite Italian restaurant this day. We want to eat pasta, okay? Pasta is a high carbohydrate rich food, okay? So you eat your pasta. This is you. And this is me. And you eat your pasta, you order your plate of pasta, it costs you $45 for your plate of pasta. It costs me the same $45. We're ordering the same thing. You and I are buddies. We like the same thing. Mine also costs $45. You consume your plate of pasta, you don't know anything about this product, the balanced product. This is what your blood sugar is going to do. Your blood sugar is going to spike up like that and go up to a blood sugar of 180. Okay? That's what your blood sugar will do. But for me, lucky me, I know a thing or two about fiber, and that when I eat fiber, it's going to slow my absorption and the release of glucose into the blood and cause my blood sugar to be lower. So I take this. What I do is before my meal, you know, I take this. I put it in a bottle of water. And I take it. And then I eat my pasta. What is going to happen to my blood sugar? I eat the same amount, the same proportion of pasta you eat. We all eat a whole plate together. My blood sugar is going to do this. That has blunted my blood sugar rise because I've consumed fiber first. So what are the implications of that? Your blood sugar has gone up to 180 because you did not cushion it with fiber. Mine has gone up to only 90. When your blood sugar goes up to 80, your pancreas is going to have to produce a commensurate higher amount of insulin to deal with that blood sugar, one-to-one relationship. So your pancreas for you here may produce 20 units of insulin. Okay, and make sure that we are good. Produce 20 units of insulin. For me, my pancreas may only decide, okay, only 90 of glucose. The pancreas will decide I'm going to produce a commensurate lower amount of insulin to deal with that. And for me, my pancreas may produce 5 units of insulin. Isn't that wow? 5 units of insulin. Now, I want you to think of these 20 units of insulin. I want you to think of these 20 units of insulin like the CEO that was cuckoo, that had gone cuckoo, that the employees lost their respect for. It's a high-tone CEO. The employees lost their respect for. The cells lose respect for insulin when insulin is high-tone and shut their door to glucose. I want you to think of the 5 units of insulin as that CEO who is humble. The humble CEO, you know, who the employees respect and are more likely to open their doors. That's what fiber does. It causes your insulin to be humble. When your insulin is humble, your cells respect it more. You're more insulin sensitive. The other thing is that when you have a high amount of insulin, you're going to gain more calories. Insulin is what I call an anabolic hormone. It causes you to gain calories. So for you, from this plate of lasagna that you had, you may gain maybe 950 calories. From that same plate of lasagna at the same amount, I may gain only 400 calories. Isn't that wild? You and I went to our favorite restaurant. We paid the same price for our lasagna, $45. We ate the same quantity. Your blood sugar went up to 180. Mine went to 90. you produce 20 units of insulin and you produce a cuckoo CEO. I produce 5 units of insulin and I produce the humble CEO. You gained 950 calories, I gained 400 calories. The impact of this. Impact of that. The last thing that the balance does is that because the balance is fiber, the balance is food to the microbiome. When the microbiome has enough fiber to go around for the good guys and the bad guys, there is no reason for survival of the fittest for the bad guys to hoard the food and increase in numbers. So it prevents that dysbiosis and causes things to be back to balance. That's what that does. And if you reverse those conditions, you can reverse that. So the other benefits, I want to flip over and just make sure you guys are with me. There are other benefits of the Unimate and other benefits of the fiber. I'm just gonna put, you could take a picture of this really quick. This is some of the other benefits of the Unimate. If you want, you could, oh, sorry, that's not it. This is some of the benefits of the Unimate, some other benefits. You could take a picture of that. It helps with promotes satiety, makes you to feel full. It acts like a GLP-1. So people who are on it actually lose weight because it acts like a GLP-1. It supports healthy cognition. Helps to maintain endurance. We talked about lipolysis. It supports weight management, promotes healthy digestion, your metabolism. So those are other benefits of that, and it supports a feeling of well-being. And then there's some other benefits of the fiber. I'll answer that question. Just hold on that thought. How long do you take this? I'll answer that question. Okay, so these are some of the other benefits of the fiber. It also helps with satiety, helps you to feel full. It causes the body to produce GLP-1s too. It decreases inflammation, free radicals, promotes fat burning. It helps you to control your cholesterol. My cholesterol dropped by 64 points while I was on this. For 3 months, my cholesterol dropped by 64 points. So it helps to control your cholesterol. When you go to the PDR, the physician's desk reference, you're going to see that this talks specifically also about how to control your cholesterol, that this helps to bring down cholesterol, bring down A1C, maintains your gut. So that's that. I'm going to explain to you how long I'll answer the question about how long you take it shortly, but I make this bold statement now that if you suffer from any chronic medical conditions, the Feel Great system is a solution that can help you live life again. That could help you reclaim your health again. And that's the hope I want to give you, that it can help you to reclaim your health again. Now, I want to show you guys first some testimonies of people who have taken it. And I'll start with me. Somebody asked me, what am I drinking? I learned about this in March of this year. And since March of this year, I've been on it, since March of this year, I've been on it and I plan to be on it. Food is medicine. I take this as my food. The beauty about this is, and to answer your question, how long do you take it? The beauty about this is food that when I eat, I don't have to give up my pizza. I don't have to give up the things that I love, and I could maintain a healthy weight. So I will answer you back. How long will you want to take a nutraceutical product, or how long will you want to eat a food that doesn't let you give up what you love, your pizza, your your rice or what have you, and still maintain a healthy weight, and you could eat your pizza that you like. Let me ask you that question. How long would you like to take a product like that, or a nutraceutical, a food like that, that helps you to eat whatever you like and maintain your health? That's the answer to you, how long you should take it. Okay? Now, I want to show you guys testimonies, and then after that, I'm going to show you how to order and how to use it, or how to use it and how to order. So I'm going to turn and show you guys some testimonies right now, and I'm going to start with myself. Okay, I'm going to start with myself for the testimonies. Yeah. So the beauty of that is you could eat the way you want to eat and never have to worry about anything by taking that, because that goes and balances everything, keeps everything normal, in check. You don't have to give up, any of the things that you love. I want to start with myself. So this is a picture of me right here, and I've been trying to lose weight. Normally, I should weigh 164 pounds. That should be my ideal body weight. I used to run, I used to intermittently fast and all of that, and I could not lose the weight that I needed to lose to get to my ideal body weight, okay? Now, this is a picture of me 2 months after being on this. 2 months after. And all I did not change anything. I did not change what I ate or anything. And in 2 months of using this, for the first time in my life, I became at my ideal body weight. I went from looking like this to looking like that. That was what this did to me. So I asked the question again, how long? I didn't change what I ate or what have you. How long will you like to, take a product like that can cause you to eat and live the same way, but have the health benefits that you need to have? Food is medicine, I tell people. You can make food your medicine. And for me, I've decided that this is my medicine. It's my food, it's my medicine. The other thing I say is my cholesterol. Somebody asked if it's going to help your cholesterol. This is my cholesterol. My total cholesterol used to be 261. It went down from 261 to 197 in a period of 3 months using these two things, okay? Normally, when I went and saw my doctor with this cholesterol, he threatened to put me on statins. I told him, no, I'm going to work and do some lifestyle stuff. And that was right around the time that a colleague, a physician, told me about this. What flavors are on the packet? This packet, the flavor here is mixed berry. And this one, the flavor here is lemon ginger. There are many different flavors. So that was my cholesterol. And then this was my LDL, what you call the bad cholesterol. My bad cholesterol went down from 207 to 138 in 3 months. So that was me. That is my testimony on using that. So I don't know what your issues are, but this can help you. I'll show you some stories. This is somebody using the protocol. They lost 74 pounds. Their migraines are gone. Their arthritis, they've never felt better in years. This is somebody else, who after 7 months, their A1C went down from 6.5 to 5.6. Their fatty liver is gone. Their sleep apnea is gone. Their A1, they lost weight also, just right, lost 48 pounds of weight just by using that. This lady had lupus. Lupus is an autoimmune disease. This lady had rheumatoid arthritis and autoimmune disease, diabetes, all of that gone, and she lost 40 pounds. Look at what inflammation and insulin resistance will do to you. This is somebody's transition, over a period of 2 months using this. You see the transformation. You see, insulin resistance causes you to age and age very fast. This right there is the difference between, a couple of months just by reversing her insulin resistance and energy deficiencies. This is my friend John. John was diabetic for 25 years. John had a chronic ulcer on his foot that could not heal. John heard about this product, and 1 month of being on this, John lost 60 pounds and he reversed his diabetes. 1 month of being on that. This is another story right there. And I want to play this video of Jimmy.
So I'm here with my friend Jimmy, who's the same protocol that I do, and I was able to reverse my insulin resistance. This is Jimmy. Jimmy, what was life like before the protocol?
And it was crazy. So 12 and a half years ago, I was diagnosed with hyperthyroidism, and so I had asked my doctor what's the best, way for me to, change this and get healthy again. Diagnosed with hyperthyroidism, and so I had asked my doctor what's the best, way for me to, change this and get healthy again. Per doctor's orders, and that's when my health started declining really fast. Started gaining weight, got the chronic fatigue. Next thing I knew, I was type 2 diabetic, sleep apnea, depression, all because of all of it. High blood pressure. It's like it was just one thing after another, and life just really sucked.
Since you've done this, how has your life changed?
Since I started the protocol, I actually found it on TikTok, believe it or not, and decided to give it a shot because there's a 90-day money-back guarantee. I was all in because I had literally given up on life and I didn't know what to do, where to turn, what direction to go in. Life just really sucked for me to be the heaviest that I ever was. All in, consistency. In 90 days, I was able to reverse my type 2 diabetes, reverse my fatty liver disease. The sleep apnea started going away. The blood pressure was normalizing. Depression was gone. ED, erectile dysfunction, gone. I was able to lose 46 pounds in that first 90 days, but I've been doing it for 19 months now, and I'm down 88 pounds and off of 8 medications. I've got my health back. My life is back.
That is amazing. Thank you for sharing that, and I pray that this changes
Yeah.
our lives.
Yeah, so that is Jimmy. Many other stories. This is somebody else before and after. A1C from 14 to 5.9. Many other stories. This is another Cody here. That's Cody. Fatty liver gone. This is my twin sister, guys. My twin sister also struggled with her weight. This was 2 months on being on the Feel Great system, and she lost 26 pounds in 2 months. 26 pounds, my twin sister. This is my friend Festus. He had sleep apnea. His sleep apnea is now gone. So those are the testimonies of people, who have been able to use that, and reverse their disease condition. So I want to show you guys first how to use it and then how to order. I'm gonna put some water in this to show you guys. So I'm going to show you how to use it and how to order. I'll be right back. Just give me a second. Okay, all right, I'm back. So this is how to use the balance. When I wake up in the morning, it comes in the bottle. When you order the product, it's going to come with a bottle. So I open I tear it open. I tear it open, and there is a mark right here that says Unamate. You just fill the bottle to the Unamate level. So I just empty the powder into it. Empty the powder into it, and then after that, I shake it. After I shake it, what I do, I just start sip. You don't drink it all at once. I just sip on it every 10 to 15 minutes. It's recommended when you sip on it, it's going to help you to fast and not feel hungry. For the most benefit, it's recommended that you don't eat breakfast when you are drinking this. You eat only, you go to 2 meals, you eat lunch and dinner, you fast, because intermittent fasting is also one way to reverse insulin resistance. And for those of you who are not able to fast, this takes away the willpower, because when you drink this, it goes and causes the body to produce its own GLP-1s and shuts down your hunger center, so you can fast without feeling hungry. So that's what I sip. I sip on it throughout the morning until lunch. And then I break my fast. After I break my fast, I eat my first meal at lunch. I make a second bottle of this. So I drink 2 sachets of this every day. I make a second bottle of this and I drink it every 10 to 15 minutes for another space of 4 hours. So that's how I do that. Then the fiber. What I do for the fiber is recommended that you take the fiber once a day. Recommended that you take the fiber once before your heaviest meal, because on this protocol, when you're using the Feel Great system, you should not eat breakfast. You should eat only lunch and dinner. This helps you to miss breakfast. So you will be down to 2 meals. So they recommend you to take this at your heaviest meal. If your heaviest meal is at lunch, you should take it 5 to 10 minutes before lunch. If your heaviest meal is at dinner, you should take it 5 to 10 minutes before dinner. And it's simple. It's also powder. So what I do is I just tear this. Where you have the MAC, there is an easy tear MAC right there. You tear that. After I tear that, you put that, and you want to use, for this one, you want to use room temperature water to mix it. And I just pour the powder in that. There is also a level that says balance, so you fill it to the balance level. I just pour the water in that, and then I shake it. And then for this one, you don't want it to sit around. You shake it, you want to drink it all at once to go into your belly to protect your blood sugar from spiking. So I'll drink this all at once, because when I'm done here, I'm going to go break my fast. So you drink it all at once. You wait at least 5 minutes before you have your lunch or your dinner. And so that's a simple way. That's how you take it. So I want to end by showing you then, how do you order? If you're listening to this and you're interested, it's something that you would like to try to be able to reclaim your health again, this is how you can order. I'll put this right on here. All right. So to order, if you're interested in this, 2 ways how to order. Just text Reclaim Your Health to this number, and take a screenshot of it or what have you, 910-297-9853, okay? Just text Reclaim Your Health to that number. When you text Reclaim Your Health to that number, I will personally get that message. I'm going to send you my order link on how you could get it. So just text Reclaim Your Health to that number. Take a picture, screenshot it or whatever you, or write it down. Text Reclaim Your Health to that number, Dr. Dieter. I will personally receive that, and I'm going to send you a link on how to get it. Now, somebody asked an important question. I'll take that off. I'm going to answer that question, but I want to put another way that you can get it is using this. Another way that you can get it is you can just do that. You could just scan. You could scan this code, this QR code that I have on here. If you do not want to text Reclaim Your Health, to that number that I said, you could just take a screenshot of this and scan this QR code. It will help you to order. I'm happy you asked the question, how much does this cost? So this costs an average of $5 a day. If you go to the company that sells this product, I'm going to go ahead and put my the other. So that's one way to get this. Either you scan that or you text Reclaim Your Health to my number. One way to do that. So this product costs $159 a month. Okay, if you get it through through that link, or you text me, it costs $159 a month, and the $159 a month is for a subscription. So if you do a subscription for me, if you do a subscription, when you go online and you do a subscription, it's gonna cost you $159 for a 30-day supply. And when you do that, it's gonna come like this. Let me take this off. It's gonna come like this. It's gonna come in this box like this. Okay? You're gonna have 2 boxes of the Unimate, and then you're going to have this bottle that it will come with. Okay? This whole box, if you do a subscription, is gonna cost you $159. Now, if you want to do it a one-time buy and not do a subscription, this is going to cost you $169 if you just want to try it one time without a subscription. The beauty about the subscription is that it will cost you $159 and you could cancel the subscription at any time. How can someone get into selling it? Noah, if you want to get into selling this, send me a direct message. I could hook you up into getting to sell this. So if you're interested in becoming a distributor to help sell this, just send me a direct message. I can get you the link. I can hook you up into how you can begin to sell this. So that's it. When you get it, it'll come in this box. 2 Unimate, 1 balance. That the cost is $159. $159 if you do a subscription, or $169 if you don't do a subscription. Now, I say this, and I'm going to put this. I'm going to put this on here. If you were to go online and look for this in Walmart or what have you, can you guys see what I have on the screen? If you went to Walmart, you're going to see that online, you're going to see that there is can you guys see what I have on the screen right now? Is there anything on the screen? Can you give me a thumbs up if there's, can you see the picture I have on the screen right now? Okay, yeah. So if you went online and you went to Walmart to look for this, you're going to see it for $128, and you're like, Dr. Dieter told me it's $159. Why is it $128? If you notice, in that very first box, there are 2 boxes in there. So there's only 1 Unimate and 1 balance that they are selling to you for $128. Whereas the company is selling you 2 Unimate and 1 balance for $159. So this is a better deal, far better deal. Also, you may see it on Walmart for $179 or $178. All those are not as good of a deal as if it's $159. So if you're interested in getting it for $159 or $169, depending on your subscription, don't go online. You're going to pay more for it. If you text me directly and I send you my discount code, it's going to cost you less. If you went directly online to the company that makes this, the company that makes this, their name is called Unicity. If you went online and you did not have a referral code or you did not have a discount code, it's gonna cost you $235. On Amazon, there's some people selling it for $235, $245. If you went, that's more expensive. But if you use the referral code, if you text me and I send to you the referral code, and that's how to text me if you are interested. to how to order, you send me a text and to this number, and I'm going to give you a discount code and a link on how to order. Or you can just use my QR code here, and using my QR code here, you will get it discounted for $159 for a subscription fee or $169 for a one-time. Now, that is it. And if you guys have any questions about anything, you're interested in this, you want to be part of marketing it, or you want to take it for your own health, I've given you those 2 links, those ways to be able to order them. Send me a text message or use that referral code and scan, or use that QR link, and you should be able to go directly to the company that makes it. Now, when you go directly, I'll end right here. I'll just show you this. When you go directly to the company that makes it, what's going to happen is you're going to I want to show you guys one last thing. You're going to see the different flavors. So if you go directly to the company that makes it using the information that I give you, when you click the links that I send you, you're going to come to a page first that says buy now. When you hit buy now, and you can find this information on my profile. I have ordering information on my profile. It will take you to the company that makes this, called Unicity. Right here are the different flavors. These are the different flavors of the Unimate, and then below is the different flavors of the Balance. You can choose whatever flavor you want of the Unimate or of the Balance. And then you see right there where it says $159 or $169. $159 is for a monthly subscription, which you could cancel anytime. And $169, is for a one-time buy. If you do not use a special referral link that I send you, it's going to cost you the $235 or way more than that. And then all you do is just hit add to cart. When you hit add to cart now, it's going to take you to this page that says checkout, and you hit checkout, and that is it, and it's done. And that's how you order. So if you're interested in getting that, interested in using that, you have the information, you have any questions, send me a direct message. Thank you guys for being on my live today. I look forward to seeing you guys again on another live. Bye-bye for now.